Hi, I'm Amber, and welcome to the Lone Star Keto Podcast. Today we have a special guest with us, Elie Jarrouge. He is a hospitalist and a health coach, and he has a lot of background in internal medicine. Welcome, Elie.
Thank you, Amber. Thank you for having me.
Absolutely. I'm really excited. I follow Elie on Twitter and now on Instagram. I didn't even know you were there. But he posts such wonderful things. It's so positive, and he really focuses on obesity and diabetes, which are two of the things that I feel pretty passionate about. So we're going to be discussing a little bit of that. And also, he is really big on trying to get to the root of the issues instead of just doling out medicine. And I love, 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 love that. And I love seeing more and more doctors get on board with this, that trying to find the actual problem instead of throwing medicine at it. Love that. Love that. So Elie, let's get started. And can
All
you give
right.
us some background on you, personal as well as professional? And I want to hear a little bit about your health story too, because I've read about that a little bit, and you've gone
Sure.
through some things too that I think really plays a part in how you approach medicine now.
Absolutely. Thank you for having me again. My name is Elie. I was born and raised in Lebanon. I grew up there, went to middle school, high school until age 18, and had the opportunity to immigrate to the United States. So in 2000, I was 18, right on time for college. I came, and I always wanted to be a doctor at the time. So growing up healthy, I saw a doctor come home and treat my grandmother. It was very like, that kind of old fashioned style. So I always was fascinated by it. And I mean, I was always healthy, fit, and athletic. So I never thought about it. I just want to be a doctor, want to help people. So I went through the traditional, I didn't know much English. So a lot of it, I'm like French educated background. So there's a lot of challenge in college and undergrad. So came in, culture shock, all of that stuff. But, I had that mission to become a doctor, whatever that meant at the time. So it was a one track mind. So I did undergrad in biology, then I got into medical school. That was in SUNY Buffalo, New York. And from there, I had visited Houston for away rotation, and I liked the Texas Medical Center. And I
Texas.
decided to apply there among all the places, and I was ranked to match a match in Houston at Baylor. So I moved here in 2008. And then in 2008, 2011, that was my internal medicine training. I graduated medical school in 2008. Then I did nephrology fellowship, which is training in kidney diseases from 2011 to 2013. But I pivoted after that and went back to just general internal medicine in a hospital setting. And that's a field called hospital medicine, or I've become a hospitalist. And then for the past 2013 until now, I've been doing that from the county hospital to private hospital with a Baylor umbrella. And that's my career journey. But I can tell you about my health part.
Yes, let's go for it. I want to hear about your
Sure.
health.
Yeah. So I never took health. It was always a second thought because I was always lean and thin and athletic. So I never really thought about it. But from graduating medical school to through residency, just those years, being busy in education and learning, I started adding weight, but it was subtle, 2, 3 pounds a year. So over a 7, 8 year period, I had gained 30 pounds. Waist, started going up, and you're getting older, make fun of it. And, so then right around 29, 20, 30, when I was there, that was the lowest time of my health, where I didn't realize I was having higher blood pressure. I was tired all the time, and then it started throwing out my back. I didn't think much of it. One time I was putting pants on, and my back gave out. I don't know if you ever had that problem.
No.
Severe muscle spasms. So I was like twisted and walking in the mall just to get to my car. It was miserable. I was on the floor for 2 weeks, and I kind of ignored it. And then that for the next year, it kept happening every 2, 3 months. Just kind of, if I try to work out or exercise, I throw out my back. If I pick up something heavy, throw out my back. And then in between episodes, I'm just kind of tight all the time, feeling tired, and didn't make much of it. Went to physical therapy, rehab, and all that stuff. Nothing obvious. Everything looks good. Then I decided to look into nutrition. I wanted to lose some weight. I was almost kind of judged or pass judgment on people like, you're overweight because you eat more. duh, you just have to stop eating, and you would judge people. Obviously now I regret all of that, but at the time, so that was like, I'm eating fine. I don't eat a lot, but I'm packing on weight. So I started looking into that. I started with the Whole30. At the time, it was popular, 2014, the Whole30 program, which is paleo, and then I lost 15 pounds, and I was like, okay. Then my back started getting better, so I wasn't thinking about it. Then I did it again. I lost another 5 pounds, so 20 pounds total. Then I slacked off like everybody else. And it's like, okay, I'm done with the 30 days and let me go back to normal. And then weight start coming back up and then having the same issues. Then I started hearing about these crazy ideas about keto and, saw, Gary Tubbs somewhere online, and then, Jason Fung and all that stuff. So I started reading, but I was scared of it because, fat, it kills you, it gives you heart disease. So then I decided in 2017 or 18 to just dive into keto and just experiment with myself. And I did it for 2-3 months, and I never felt better in my life. Like my back pain completely gone. Lost weight more than I expected. So I lost 35 pounds. So I was like down to when I was 16, 17 years old. And all right. And then I became like, you can't unsee it when you see it. So I could not, then I had to learn more. So I dive into podcasts and reading books and all that stuff. I mean, we can go as much as you want, but from there, I started gravitating to more meat heavy because I developed a keto rash, which was completely miserable for me. Because I would happen on my neck and my back. I was very lean, and I felt great otherwise, but that rash would never go away. I tried so many things. And I was at a conference somewhere, and people told me, one guy told me, you're probably not eating enough protein. And I thought about it. Okay. But at the same time, I was in deep ketosis. So every time my 3-4 millimoles, I'm like really wired and feeling good, but the rash is itching and just started to scar. So I pivoted. And then this one, the rash went away, and I started feeling even better, more steady, and I don't have to look for fat and just dump fat on everything. So I changed that, and that's how I evolved. I kept my mind open, and then shifted to that. And now I've kind of focused on the big concepts rather than particularly call it anything particular. Seems to trigger a lot of people. So I remove those words: keto, carnivore, paleo. Just kind of focus on real food. So here I am.
That's actually really smart. And I'm seeing more and more people do that because for whatever reason, you say the word carnivore and it's like, oh my gosh, or even keto. It's getting a little bit better with keto, but still people just all of a sudden put up a wall and it's done. They're over it because there's so much negativity for whatever reason. And people just have that negative attitude. So that's actually very smart. And I probably should start approaching it more like that.
I learned it the hard way, especially because when I tried to influence friends and family, and they're resistant, keto, that's crazy. That's too extreme. And what is keto? What am I doing here? I'm really eating real food, but just change the proportions and turning things. So I think I was dogmatic maybe for a few months when I was so excited about it. I discovered the new world. And then you slowly get humbled and realize not everything is right. So I always find myself wrong in certain things, and you just adjust and adapt. I always thought, oh yeah, you can have all the fat you want. And then I realized, discovered Ted, and went to the PE diet route, and I read his book. So I added that into the mixture, and I got even leaner. So I know there is more to the story than just, low carb, and I still believe it's kind of the bedrock of it, but there's more to it, to the equation, and it's very personal. Like some people cannot lose weight. My sister, I had to put her on long fasting, despite being carnivore almost, to kind of start losing weight, break that hormonal dysregulation, and some people, they just stop, and the next day they drop 5 pounds,
I know that's those people. Although with keto, I was just consistently dropping. It was so easy. Every week a loss. Every once in a while I'd go up or stay the same, but most of the time it was just a steady going down.
And just patients do it. See, I never had a problem with my own body, so I could never really relate. But then when I start seeing families struggle and I have to find other solutions, it's not everything, just stop eating carbs, it's just kind of what else is going on, the emotional part, the fat part, the, frequent eating. There's so many different part of it. So, it just kept changing my approach.
And that's what I really like about you, the whole evolution. And that's where I'm kind of at now. Now, yes, I do call myself a carnivore, whatever, but I don't care about titles. I don't care about all that. But I think you do have to evolve, especially women. Oh my goodness, as their hormones change, there's so much going on that what works for you today may not work for you tomorrow. And that's
Yeah,
okay. That's okay. It
yeah,
doesn't mean what you were doing is wrong or bad. It just means your body's changing, adapting. You have to change and adapt with it. And
yeah.
that's what I'm having to do. I mean, I'm struggling with a few things
And I'm learning from the patients more, like things I'm not even thinking about. Like a woman tells me, "Oh, I'm on menopause, but I'm having a harder time." They're like, okay, so I have to think. I mean, men are just, just the same thing.
pretty much.
A,
Yeah.
you get B. With women, there's 17 different equations where you have to look into the hormone, the cycle, and all these things. And so it's more challenging, but it's definitely more interesting because you can still. There's a solution for every problem. You just have to think outside the box a little bit and not be too dogmatic and stuck to your own guns.
Absolutely. Before we get into the questions, would you just clarify what exactly is a hospitalist?
Yeah, so it's a primary care doctor in the way of the hospital. So if you go to the emergency room and you're sick, you have COVID or you have pneumonia or you have heart attack or GI issues, you need to be admitted to the hospital for more workup and treatment. They call the hospitalist in the hospital. They basically run the show. It's been like this for 25 years or so. It's just kind of you become the primary care. You coordinate care, you treat, you consult if you need to, other consultants, cardiologists, gastroenterologists, all kind of fields. And once the care is done in the inpatient setting, they transition to the outpatient. So I don't see patients in the clinic for that role. You just work in the hospital. You run around and you're not on any clock. It's not like you have 30 minutes or 20 minutes to see the patient. You have a panel of patients. You got 12 your whole day just to kind of manage the care. And that's what I like about it. It's very flexible. I can spend more time with patients and you get a lot of time off when you're not working in the hospital. And that's how I just managed to learn myself a lot about nutrition and take it to the hospital sometimes. And just a kind of a natural progression. I started applying it with patients and just advising them there because I was so frustrated with doing the same thing and seeing the same people, not the same people, like the same diseases, again and again and again, and the complications.
Absolutely. Okay, so let's talk a little bit about when you were in medical school. I hear a lot of doctors say that they either they didn't really get nutritional education or what they got was very limited and kind of from biased sources. What was your experience in medical school?
It's similar. I don't actually remember what I ate last week. So sometimes you forget what we actually learned. There's so much information in medical school packed, especially the first two years. What I remember most is first year, you learn a lot of biology, biochemistry, and real science. At that time, things make sense, Krebs cycle and fatty acid oxidation and how glycolysis and gluconeogenesis, all these things that people just kind of like to talk about. But then when you start jumping to the clinical setting, you start with a pyramid, and then you have to eat 60% carbs, and then the rest in the grain. So by the time you're so busy trying to learn this stuff, you don't even stop and question, this doesn't make any sense. So we get diet nutrition education from a sense like what the pyramid, what the healthy eating is supposed to be, but really we don't dive into it beyond biochemistry. And the rest becomes organ-based, and you start, how do you treat a heart attack? How do you treat arrhythmia? How do you treat a stroke? How do you, then becomes just disease-oriented rather than whole system-oriented. So nutrition just falls to the side.
Yeah, and we've seen the results of that, haven't we?
Yeah.
For sure. Okay, so I am going to read your mission statement just because I really liked it. And I've been kind of watching and reading people's mission statements. I never really paid attention before, but there's some really good stuff out there. And I loved yours. I really loved it. To reverse the course of obesity and diabetes, one person at a time, in order to maximize health span and allow you to live the healthiest life possible as long as possible. This is accomplished by attending to the physical, mental, and emotional experiences in life and consciously respond to their causes. I love that because you know what? Diet is extremely important and it is a huge, huge, huge piece of the puzzle, but not the only piece of the puzzle.
Exactly.
And if you're not attending to the other parts, it doesn't matter what diet you're on. It's not going to be a long-term thing because you haven't dealt with the mental and the emotional part. And I love that you focus on that. Okay, so you do focus on that. However, as a hospitalist, I'm assuming that is not something you can really get into. So my question is, you're also a health coach. Well, you're a doctor. Why are you going to be a health coach? Explain why.
Yes. Well, this statement, obviously, I'm not going to take credit for every word there, but because we'll borrow ideas, right? So I've started with nothing, with conventional fat diet, to evolve and start getting bits and pieces. And you go through your own personal issues and your own, insecurities and your own mental issues. And then you start to learn and then evolve, and then realize, become a whole picture. And then by the time I decided to act on my desire to be a coach, help people, it took, a couple of years to formulate and become that person that I can help others. So mental health, I do focus on it indirectly in the hospital, because when I sit down with a patient in a vulnerable state, they're sick and they really want to do something different, it's easy to tell them, well, stop eating this. I mean, first of all, I tell them, whatever you do, just don't copy whatever on your trays in the hospital, because that's where you start. Then we talk about, it just depends on the personality and the person who opens up. Sometimes they open up a lot. So I empower them. I talk about, mental health in terms of focusing on really realizing what's right for you and just do the right thing and putting yourself first, because you can't help others and help your family if you're not healthy yourself, mentally, emotionally, physically. All that stuff. So to become a health coach, I didn't want to be tied down to insurance and expectations and things like that. And so I wanted to spend time and talk, because as a doctor, I mean, yeah, I can write a prescription, but beyond that, my MD degree is not what's needed for most patients. What they need the handhold. They need some education and somebody to kind of walk with them on that road. I mean, I've failed a few times. I'm sure you've done much. I mean, my journey was by no means that extreme. I mean, yes, I had problems, but I've seen some. I mean, you mentioned, I read your story, like, I don't know, over 100 pounds.
Half my weight.
Yeah. So that's even, I can imagine the burden of the psychological burden, or the bullying or the teasing or whatever over time. So that you can be thin and still feel obese in your head. So I wanted to be that coach where it's okay. And, you messed up today, just start over, there's no point to go back. So I like that relationship with people. So I just wanted to be a coach. I still play doctor because people in Texas are medically licensed here and they're diabetic, and I'm helping them come off medication. So I do play the dual role with them. And even if I'm not going to be their doctor, I give them advice to talk to their doctor to come off. I just empower them to do more, not just, doctor said. I mean, don't believe me too. Just do your own research and try.
I love that you empower either your clients or your patients to take their healthcare back. I love that. I think that is so important because I'm not saying every doctor out there, not even, but a lot will just be like, okay, this is the way it is, period. Don't question. I'm the doctor, you're the patient. Stop. And I find that a lot with women and they have like, you know, all these issues, but, you know, like I have pain constantly. I don't know what's going on. I don't know. Maybe you have fibromyalgia, whatever. You're just gonna have to deal with it,
Yeah.
you know, and see ya. And then they're feeling so defeated and like, okay, so now
What's wrong with
what do I
me?
do?
You know?
Yeah. And yeah, that's exactly it. And that's the same with you know, weight loss. For so long, it's the person that is to blame. And I'm not
Right.
saying that you don't have a responsibility. Obviously
Right.
you do. But sometimes the diet is wrong. It's just
Yeah.
wrong.
Yeah.
It may be
Yeah.
okay for somebody else, but it may not be right for you. I'm not poo-pooing on every diet out
Right.
there.
Right.
But, you know, in my experience, what I'm seeing, you know, a lot of times it's the diet that failed you, not you
Right.
failing. And I
And
just think it's sad.
yeah, it's very sad. That's why I tell people, don't expect anybody to save you. That's why you can blame whoever you want. You are responsible at the end of the day. And some people don't like it when I tweet about you are responsible. They think I'm blaming people. No, you are responsible because who's going to do it for you? You're the one who's going to stop the victim mentality and then, you know, take things into your own hands and start doing something about it. You know, try. You don't know where to start. Start somewhere. Whatever you're doing is not working. So try. It doesn't matter what camp you want to start. Just try. It doesn't work. Adapt, and then when you take action, it becomes easier. It's the hardest part is taking the first step. So
That's the truth. And then you can evolve from there. And
yeah,
it's okay. I mean, to try different things. It's okay to figure out what's right for your body. You don't
right,
have to do what everybody else is doing or
right.
what somebody tells you is the only way to do it. Oh, I really hate that. I really hate that. I've been getting a lot of that lately.
Black and
I'm
white,
like,
even
oh,
in a low carb, in a low fat. I mean, it's all camps. It's just when they feel so sure of themselves, you know they don't know enough. It's
yeah.
the more you learn, the less sure of yourself become. The more nuanced you
Yes.
become,
Yes.
and you can tell. You can tell who's. I mean, I don't engage most of the time because I'm not interested because they're not there to learn. They're asked. They just want to, you know, feel better about themselves by, you know, picking at your tweet. But yeah, most
Yeah.
of the people I respect, they just say I don't know a lot, and that's sometimes the best answer because there's so much nuance in things, and I learn from them. So I'm not. I mean, I admit it. I'm not the science guy. I'm not Ben Bickman. I'm not the guy I'm not Tro who's reading every paper under the sun. But I trust him, so I know he's doing all this stuff because he's passionate about the science, and I like the synthesis of things, and I test it out. It works. I'm good. I mean, and I can take it to the patient or the client and help them.
I love that. And see, that's the thing. When you find somebody that you really feel you can trust with the info, it doesn't mean that they're not going to be wrong, but those type of people will admit it most of the time and say, you know what, I was wrong with this. Now here's this new study and it's debunking all of that. So now we kind of maybe need to look at this a little bit more. And I love that. I will trust somebody like that. I would rather somebody be wrong and figure out the right way than somebody who, you know, thinks they're perfect or whatever, you know, and it doesn't bother to change. So I love that. Okay, let me ask you, why do you focus on obesity and diabetes? Why is it those two things?
Sure, sure. If I have a chance, I would focus on everything. I think about cancer these days more often in a metabolic sense than anything else. Fatty liver disease, you know, strokes, heart attacks, all these autoimmune diseases, all these things. I know I always feel like diet will change it, but at the end of the day, I have to be more focused, and I wanted to catch as many fish as possible in my small net. So I found obesity and diabetes are the most prevalent, and they're the common to all of these diseases, a lot of them, and they all share the same root cause, at least partially same root cause. So if I focus on that, person who has obesity, most likely they have pre-diabetes, they probably have fatty liver disease, they may be anxious and depressed, and they may have a higher risk of cancer. So if I just target the health, getting healthy from that standpoint, I can affect everything downstream directly or indirectly. Same with diabetes. If I focus on diabetes, I probably prevent them from ending up on dialysis, which is the field I trained in, and I didn't want to do because it's chronic management of things. So that's why I want to focus as be as broad as possible and as focused as possible at the same time. Hopefully that makes any sense.
That does. It makes sense to me. I get it for sure. Yeah. And so with the patients that you see, what is a very common thread through it? Like, what do you see the most of? What can you like boil it down to? I'm sure you see a wide variety, but is there a commonality?
Yeah. I sometimes feel about that. I mean, I'm making up the statistics is more for than 50%, but let's say 60 to 70% of patients in the hospitals are there due to complications of chronic metabolic diseases. Most often it's diabetes. So every time, I mean, you write the history and physical, and then you become numb to what you write, but so-and-so with history of diabetes, hypertension, coronary artery disease, you know, all these, you list, they always come in cluster. Admitted for a stroke, or admitted for heart attack, or admitted for ischemia, or the lack of blood flow to the leg, or kidney failure, or anything like that. So it's the same stuff that if we rewind the clock 10, 15 years ago, they would never be here if we act on it then. So I'm not talking about people who get pneumonia or get into a car accident or genetic mutation or something. Of course, people are going to get sick. We're all going to die one day. Sometime we're going to need care, but most of it is something that's preventable. And a lot of times it's too late when you get this massive stroke. I mean, what are you going to do? I'd rather be dead than be a vegetable in bed. But a lot of times you can reverse things, you know. High blood pressure, reverse it. Diabetes, reverse it. So you don't get to those complications.
Okay, so the whole diabetes reversal thing. I've heard so many people say, you don't know what you're talking about. Just shut up. Once you have diabetes, you always have diabetes. You have to have insulin and you have to have carbs. You must have carbs through the day. And they follow to the T the guidelines of the ADA. What is your thought on that? Like, can you really reverse diabetes? I mean, really, can you reverse it? Or are you always going to be diabetic? Type 2, not 1, type 2. We'll just leave it at that. Yeah.
Really,
Ooh, they go. Yeah.
Type 2. So type 2 is insulin resistance, leading to a point where your body can't hide any sugar, so just floating in your bloodstream. You got there for a reason, and you got there by the way you're eating. And the only way to reverse it is to reverse the way you're eating. I used to think chronic disease, you can't do anything about it, just diabetes. I mean, just kind of more thoughtless, not like I believed it, I just accepted it. I mean, that's, they can't be wrong, you know, it's you know, authorities are telling you this. So you prescribe more medicine. When you give more medicine, that now we have more options, but before, more medication that raise your insulin even further, which you already have too much of it. And then they gain more weight, and they said, "Doc, I'm gaining weight. When you stop, you know, eat less. You know, yes, the side effect. You get insulin, you're gonna gain weight. But when you gain weight, your diabetes gets worse. So after a few years, you start with one medication, 2, 3, then you become on insulin, and you just kind of you blow up, and then you start having all these complications. And then you see diabetes reversal. If you don't want to use the word reversal, you can put a remission, because remission may be a better term, because if you go back to your old lifestyle, it's going to come back. So call it whatever you want. It's basically temporary reversal, or putting in a remission by removing the offending cause. You know, if you have a splinter in your finger, it hurts, don't, you know, just remove the splinter. So let's remove the food that keeps your insulin high, and then that works. And I believe it, because I work with clients, sometimes they've been on medication for years, and within a few days, they're calling me, oh, my sugar is 50, then I have to quickly stop some. I knew it was going to come, but I didn't know like that fast, you know, especially, you know, so just give them the right advice. It's sad, like you should be on insulin for 15, 20 years, and then within a week of starting, you're like dropping medicine left and right. So it almost makes you angry, because really? Yes, it's simple, not too simple, but not complicated either. So you just have to, it is reversible. or put it in remission.
Whatever you want to call it. Yeah.
Yeah.
That is kind of a tricky terminology, really. But I think that's true with so many things. I mean, just like obesity,
Yeah.
once you lose the weight, you're not obese anymore.
Right.
Is that just, a reversal or is that what is it? But if you went back to eating the way you were, you're going to blow up again. Or if you have
Yeah.
other conditions, there's not always that.
There's
So,
a lot of
it's
nuance,
the same
always
kind of
like the
thing.
minutia stuff, but big picture, you're right. It is like that. But the problem, I think it's easy to say and give advice, but unless the person does the work, it's all a waste. And that's why people, dietitians and doctors don't believe it, because they're human beings themselves and they have the same issues. They have the weight issues, they have the cravings, they eat, so I think it's a reflection of them not wanting to change their own lifestyle and to project it. And they may not even be aware of the psychological effect, I go to a doctor's lounge, there's muffins and bananas and granola bars and old sodas. And you walk these doctors kind of, busy, running, grabbing this, drinking. And I look at them and I'm sad because they're not aware. So of course they're not going to want that because they're in an energy crisis. They're really hungry. They're in they just need that sugar thing so they can go to the next case. And not all of them are obese, but we're blind to visceral abdominal fat. Sometimes it doesn't take much. Just a little bit of a belly pouch is not body shaming or anything like that. This just tells you there is a metabolic derangement happening. I was never obese, but nobody thought I was overweight until I lost 35 pounds. And then it's like, oh my God, like 4 or 5 inches disappeared. Where was this, So yeah, I think doctors and dietitians are human beings that have their own issues. That's why they project, but they're well-intentioned.
I think you just hit the nail on the head perfectly. And, after talking to dietitians and physicians, that does seem to be a very common underlying, theme, if you will. So, but that's also true with like your friends and your family. Like when you say, oh, yeah, I'm just eating meat, they're like, what? Or, well, it's not going to hurt you if you just have a little bit of this or whatever. Or, they look at you like, that's just weird. That's not healthy. But yet here they are eating chips and, candy and whatever else 6 times a day. And yet, because I eat only meat, I'm not healthy, so you get that. So it is like this projection thing. I do believe that. So
I learned not to say anything uninvited. So I'm not there to police people. I do my thing. If you don't like what I'm doing, and that's a reflection of you, because you seem to find something about yourself doesn't sit well with you. You're just kind of making fun of me. So I laugh about it. You gotta shrug it off.
Yeah, I'm trying to get there. I'm getting there.
And I'm 90 now. I'm recently realized I'm probably 95% carnivore. I just don't think about it this way. I just eat the food that makes me feel the best, and I still indulge in things. So people love it when I see me eat like a piece of dessert. It's like, haha, I bet. It's like, get to my shape, and then you can have all the dessert you want.
I agree with you. That's okay. Let me. Is there ever a situation where a type 2 can't reverse it? There's always exceptions, and I always get somebody to comment about this, like, oh well, you don't know because this person this happened and they couldn't because whatever. List some things that can happen to where food, changing your food is just not enough for a type 2.
Sure. I'm not going to claim to be an expert in endocrine, but there's a lot of subtypes of, after type 2 and how long you've had type 2 and then late onset, autoimmune diabetes or something like that. And Jason Fung mentioned some good theories there too about your pancreas is choked up and then stop making insulin. Although you're insulin resistant, you also drop your insulin. So it takes longer to reverse that. Or you may burn out your pancreas or the cells that make the insulin, where you reach a point where you're never going to be completely off medications because the damage has been so long, but it doesn't mean it doesn't get better. So instead of being on 7 medications, you can be on 2. So yes, there are, I think the limit is the effort and how much you're willing to go extreme to reverse it. You know, some people don't want to go all the way. I guarantee if people go, let's say, carnivore, the most elimination diet, and they lose all the visceral, extra visceral fat, they will get to a point where they can get to glucose management. But that's not real life for most people. They're just going to still be tempted. So it never heals completely. As soon as it's healing, you scratch it again. So I'm sure some people are going to always be on some medication, but being on metformin alone versus being on 150 units of insulin is a completely different type of diabetes. You may have the same A1C, which people, hemoglobin A1C, which is the marker of how the control of the diabetes, but that's just the tip of the iceberg. So the big difference between diabetic with metformin versus diabetic 150, even with the same glucose number. One of them is going to have all the complications. The other is much better.
Interesting. Okay, let's talk type 1 just real quick. Can a type 1's situation be improved by working on their diet, or should they just keep on eating them cupcakes and just up in their dosage as needed?
I think people, if they use just common sense, they get the answer. You're a human being who just doesn't make insulin. So insulin is crucial. Insulin is not the devil. Insulin is actually important. We need those spikes to grow muscles and store energy and, grow as a human being. But when you don't make it, you can't do that. So you need to supplement it. But if you do that and you go above and beyond, you're no different after that point than a type 2 diabetic, because you start, or somebody who gains weight. If you're type 1 diabetic and you're obese, you basically have 2 diabetes. You have type 1 and type 2 because, in my view, because you have type 1, but you're also on so much insulin that you become insulin resistant, so you have to need more insulin. So a good type 1, they tell you, people who have done type 1 low carb, they need maybe, I don't know, less than 20 units of insulin a day where they can just manage. But I've seen type 1 who are morbidly obese and they're on 100 and plus insulin pumps and all that stuff. So it's a spectrum. You're not going to cure type 1, but you can live a normal life and not need as much insulin, not be insulin resistance, which is the disease. So yeah.
That was very well put. I think that makes it really understandable. So I like that. Okay. You talked a little bit about visceral fat. Since we're kind of talking about obesity too, can you talk about the dangers specifically of the visceral fat, sometimes known as the beer belly on men, right? Versus the outer subcutaneous fat?
Sure. Visceral fat, we all have visceral fat. We all need some visceral fat. And more and more, it's becoming important that it's more of an endocrine organ by itself, because it secretes a lot of hormones that play a role in the overall health and signals and feedback. But when it grows too much and it just starts sending out a lot of these inflammatory signals and leads to further insulin resistance and inflammation in the body, and then just the spirals out of that. I mean, heart disease, for instance, is a chronic inflammatory disease, not just the plaque is coming from this inflammation. And these cytokines, whatever you want to call them, they all lead to that. So, and when you have your organ is fatty, things are not flowing right. Your liver is sick, your pancreas is sick, it's choked up mechanically, and also been told by these hormones and signals to do something you shouldn't be doing. So that's why it's important to reverse that to a healthy visceral fat, to decrease all these markers and reverse a lot of this inflammation.
Okay, well, let's talk a little bit too about like health versus aesthetics. And what I mean by that is, say you see somebody and they look thin, they look athletic, whatever. Based on their looks, can you tell if somebody is actually healthy?
Sometimes you do, sometimes you don't, like everybody. But I've seen, it depends on ethnicity too. So, for instance, Asians and Indians, you don't see a lot of obesity. but you're seeing extremely high rate of diabetes. And sometimes all you see is a tiny little pouch. So you have to have the eye of an artist to see the subtlety of the visceral fat. And then, and if you actually scan them for whatever reason, the read or the scan will tell you fatty liver disease or fatty pancreas or abdominal fatty tissue. So when you section it on the X-ray, you see completely different story inside, which is thin on the outside, fat on the inside. And that's so their fat threshold is completely different. I think that's a good concept for most people. Like some people can gain 300 pounds and never develop diabetes, and some people gain 10 pounds and become full-blown diabetes. I found obesity more of a protective mechanism. If you can gain weight to prevent you from getting disease, that's I would say it as an advantage. I think I don't know if I read it or thought about it, but I've become more in favor of that. Like obesity is more a protective mechanism in an energy surplus. If you can't manage that, you become diabetic and have more complications. Eventually it catches up to you. So if you keep going, so when you had 120 or 100 extra pounds on you, imagine if you couldn't gain fat, that you would have been so sick with diabetes and all these things. So I think your body being able to put on fat and store it, and a lot of it is subcutaneous tissue, which is more inert. We got to talk about that. So yeah, subcutaneous tissue, which is it's less toxic, it's just more storage. You just put in your energy there. So that's not bad. That's aesthetic. That's more just aesthetic. So, and that's common in women with hormones, and that's why fat deposits by hormonal influence around the hips and legs, and that's normal and healthy versus abdominal fat, which becomes toxic. So,
can somebody tell if they have like subcutaneous? Visceral fat. That's what I mean. Like, what is something that you can use to gauge that, especially like somebody who doesn't appear fat? What is that? Oh, a tape measure. Okay, explain.
Yeah, so I'm all about saving money for patients. I don't want to have them spend and find cheap ways to determine if their weight is healthy or not. I try not to fixate on the scale, but there's a measurement that I didn't obviously create. It's known. It's waist to height ratio. So, and that's kind of a good surrogate for that. If your waist is more than half your height, on average, you have excess visceral fat. And that waist is not your pant size, it's not your hip size. It's really the largest part of your belly, more often around the belly button and right over the hip bone. So if you measure that, divided by your height in the same unit, inches and inches, centimeter, and if you're getting more than 0.5, within a range, you have too much visceral fat. And so women tend to be 0.51, 0.52, 0.53 is fine. But men, all the way down to 0.4, 0.42 is a good range. I like to aim for 0.5 for most people early in their journey without having to measure much. So that's how I look at visceral fat.
I like that. That's really good.
So that's what I tell people: just get the $2 tape measure and your scale. The combination is information, because you may lose fat around the belly without losing weight on the scale. Still progress.
Yes, agree. I think people focus so much on the scale, and I know I did, and I have to be real careful with that because I know it will send me into a really bad place. So I have to be, because I allowed that to dictate my mood, my day, my life, to be honest. And so I have to be real. I haven't quite got over all of that. I'm better now. Now, but I still, that scale stays in the corner.
But people want something objective to feel there's progress,
Yes. And what I tell my clients, which I saw this and I'm like, why didn't I do that? Because for me, and I know a lot of people who are triggered, who have had eating disorders and et cetera, numbers, the size of their clothes, what's on the tape measure, what's on the scale dictates their value, their progress, their everything, there's, success. And I love the idea of taking a piece of yarn and then wrapping it around your waist at your belly button, cutting it. And then that way you see no numbers. You don't
Yeah.
know if you're a size
Yeah, it's
26
great.
or
I
if
like
you're a
that.
size 0. And then next time you do the same thing, and then you just hold the ends of the string, and hopefully you'll see start to see
I like that more
shorter,
because
shorter. Yeah.
every time they measure it different, sometimes they are off by an inch or two, they get discouraged. So that's actually a good
Oh, very
idea.
much. Numbers for me, and I'll admit it, and they still do. I'm not going to
Yeah.
lie,
Yeah.
but it was a really hard thing for me. And I see that over and over and over and over again,
Yep. Yeah.
especially when you're so focused on the weight aspect instead of worrying about fixing your health. And
Yeah.
let's talk a little bit about that, because I know that you feel that it's more of get healthy to lose weight versus lose weight to get healthy.
Right.
So, talk a little bit about the importance of focusing on health and that making it easier to be able to uh, lose the excess weight later
Uh,
on and to
Yeah,
keep it
I
off.
mean, it goes back to, I think, obesity and diabetes or symptom of the disease, which is the insulin resistance problem. And that became more, became more conscious about it when I'm working with a group of 10 people that I kind of gathered from Twitter, and I've been coaching them for free to help them. And then going back to the numbers, like a lot of times the numbers are not changing, but when all this stuff, the migraines is going away, the headaches are going away, the rashes, everything starts improving. So they're getting healthier, and then the weight starts falling afterwards. So I believe strongly. I mean, weight is a symptom, it's a consequence of poor health rather than a cause of poor health. Yes, it can become a vicious cycle. If you become so obese, then you put problems on your lungs. You may have sleep apnea, you need a machine, and then you can have complications from that. Yes, then obesity becomes part of the problem, but until you get there, it was a consequence of poor health. So I focus, don't worry about the scale. We just do it once a week right now because we're just tracking numbers in this program. And forget about it in between. Just focus on eating right, removing the junk, and then things start improving. And things that are improving that I didn't even know they had. All of a sudden, anxiety is lifting off, depression is gone, people are going on walks, joint pain is going away. I didn't even open my mouth about these things. They're just telling me that's happening to them. So it's no different than for weight. So I believe it.
Yeah, absolutely. It makes everything so much easier. And when you're getting proper nutrition, that is such a huge, huge thing. And it does it makes it, you have more energy. You're able to focus better. You're able to, deal with the things that maybe you were too anxious to deal with before. But now
Yeah.
you're kind of more even keeled with your hormones and all that. So you can now go, okay, let's deal with that emotional eating issue. Let's deal with that. But before, it makes it really difficult when you're doing everything all at once. It's
Exactly.
overwhelming, and I don't think
It is.
people know where to start. So speaking of which, tell us kind of how your plan works. Like when you get a patient and they're unhealthy, maybe they have prediabetes, and let's say they're right at the obese level. What is your method? What do you do to help them out? What are the steps?
Okay. We're not talking about the hospital, right? We're talking about,
Right. You're coaching.
right. Yeah.
Yep.
So it's kind of filters itself because people who seek help and willing to invest in it, they're already motivated to want to make change. So they become more receptive. But I start usually with a big screen of their health, and I just get to know them emotionally, physically, medications, medical history, all that stuff. I just kind of build that rapport and have them answer questions for themselves to kind of, why are you seeking help? Why do you want to, what would be different if you did that, and then are you willing to do so and so, and then they just, it kind of checks in with themselves. But I always start with where they are and what they're not willing to do yet. And, and I don't push that. I put it aside. Most people don't want to lift a finger or move or exercise. I don't forget about it. I don't even care about your exercise. So, and I truly don't initially, because most of them after a month or two, they start walking by themselves, and because they get the energy and they want to exercise. So I focus on food. first of all, removing the bad food and focusing on making sure they're not hungry. So I tell them, we're doing two things at the same time. We're eating less of something, we're eating more. Because if you're hungry, you're gonna fail. If you're eating this junk, you're gonna fail. So we just have to find a way to do that. Some people dive all in. Some people have to wean themselves in. So start with the sugar and sodas and juices, and just start eating more protein. Double your protein. Nobody eats enough protein. So when you start with that, kind of a week or two later, they feel better. So they kind of buy into it, and then you get motivated. It's key to have trust and rapport with the patients. Otherwise, I mean, I can talk all day. It doesn't work if they don't do it.
That's so true. Oh, okay, I have a question, and this is something that I kept getting comments on. How does somebody know if they're eating enough? And I'm talking, let's just say that what they do eat is good. So it's not an issue with what they eat, but how do you know when you're getting enough?
It's a common thing. People are eating healthy, but they're not eating enough. I think it's snacking is one of them. If you start craving food, craving sweets or not sweet, even craving healthy food, or you just find yourself eating in between, that means you're not eating enough. That's kind of the simplest way of putting it. And I do think if you're metabolically healthy, you're insulin sensitive, and you reach your steady state, if you're needing to eat more than twice a day, you're probably not eating enough during those meals. I can't remember the last time I ate 3 times a day. I used to eat 5 times a day, but so there's nothing wrong with eating 3 times a day. If maybe your portions are smaller, you just like to structure your day like that. But if you're eating enough, twice a day I feel is a good gauge that you're eating enough. And anytime you're snacking, you're not eating enough, or there's an emotional stress, and this is that whole department that you have to focus on, especially late eating. But yeah, snacking in between meals is a telltale that you're not eating enough.
Yeah, I agree with that, but I put out what I eat in a day in some posts because so many people ask me, and okay, I'm 5'2". I'm not a big person. Okay. And I'm almost 55. I'll be 55 in July, and I'm kind of getting to that perimenopausal stage. Right. And it was like, you're not eating enough. And I'm like, I'm never hungry. I don't know what to tell you. I physically can't eat anymore. I physically can't eat anymore. I'm not restricting. I promise. I'm really not. But, for most people, they're like, oh, that's not enough calories for me. I eat like twice as much as you do. And I'm like, but I'm not hungry.
You're not hungry. That's the key. The worst thing people do is eat when they're not hungry, because anticipating hunger, then you're going to guarantee you're going to get hungry, because it depends what you eat, but you're going to mess with your hormonal homeostasis. I mean, your body's telling you don't eat, don't force it. If you spike that insulin and you crash after that, then you're going to get hungry from just low sugar. But women are a little different, because I'm recently learning about the hormonal cycle and the hunger times. So if you got to capitalize and use it as leverage. If you're on your period and you have no appetite, just fast. That's fine. It's more about the average rather than the day to day. And then if you're pre-period and you're ravenous and nothing's, you can't stop eating, it's fine. Eat, but eat the right quality of food. So I can consistently eat the same way every day, but I understand some people aren't, especially women with hormonal cycles. You have to work with it. It's more about the average rather than today I didn't eat enough. But protein is one measure. If they're looking at numbers and they like to track something, the only thing I like to track is amount of protein. Guesstimate for each body is different, but at least have a minimum that I recommend. Once they hit that, there is no room for anything else. They usually are pretty full. So,
what's your view on fat? Another thing I got too is you're not eating enough fat, even though like 60 to 70% of my overall calories actually were fat.
Yeah,
how much fat?
Yeah, I changed a lot about my view on fat. I don't think fat is bad. We're not talking about seed oils, and so we're talking about
right. Animal
fat. So
yes.
normal fats, healthy fats, olive oil, that's fine. I used to think you can eat unlimited amount of it, but then for me, it worked. I changed because of my rash from the ketosis. But for a lot of women, they lose the first 20 pounds and then stop. Feel great. And then you're very insulin sensitive, but you're not losing anyway. And you have to ask yourself why. You don't have to be a scientist, because fat is energy. If you're taking the energy in, why would your body tap into your own fat stores? It has to get rid of that one way or another, where you increase your metabolic rate or use it for energy. But at the end of the day, you have too much energy. I'm borrowing probably Ted's words, but Ted's name. But that energy is there. So you become insulin sensitive, you lose that weight, you lose that water weight, but then you have to focus on too much fat stops you. So I shifted. Protein, you don't use it so much for energy unless the body absolutely has to in a starvation mode or anything like that. So you use it to build muscles and recycle things and stuff like that. So right now, I tell them, eat whatever fat with your protein to get full, and let's see what happens. If you stop losing weight, then there's something we need to do. Because at first they're experimenting, they're not insulin sensitive. When they cut out carbs, if you tell them to limit fat too, they're gonna go into crisis mode, because they're not able to get that fat out of the deep freezer. So it's gonna take time to do that. So you need to supplement with fat until these genes wake up again and start breaking down fat back into the circulation. So yeah, it kind of depends on the state. But at the end of the day, almost everybody eats more fat than they need and less protein than they need. So I tell them, I switch the proportion. You're still in keto. It's the low carb that keeps you in ketosis, but we've changed the proportion, and the fat starts, the fat weight starts dropping after that.
Yeah, I totally agree with that. And I'm like, okay, but how do you know what's going on in my body? How can you tell me I need 90% fat? How? I still have fat on my body. Do I really need that? Really?
No, my simple mind thinks if you have too much fat on your body, you don't need extra. You need to tap into that. And to tap into that, you need to not get more. Really not a medical statement, just kind of in common sense. Somebody said fasting is a high fat diet, which is true, because when you fast or eat less fat and you're keeping low carb, you eat yourself, because you need energy constantly 24/7. So if you're not getting it from food, your body's going to get it. It's lazy. It's going to get it from your body. It's lazy when you have food, so it's not going to try. You have to put it in that position to do it.
I 100% agree with that. Ooh, okay. We are pretty close to time. I'm going to go through some of these questions, make sure we got everything. Oh, just a few little minute questions to answer, since you are a doctor. I always like to ask doctors, because I'm always curious of their opinions. What do you feel about organ meats? Do you feel that is something absolutely necessary for good health?
I like organ meat. I know some people thrive without organ meat. Organ meat was part of my culture growing up. We eat liver raw, we eat kidneys, we eat brain, we eat so many things. I could never get around to eating brain for texture reason, but they tell me it's delicious. But I think there is extra nutrition there, but whether you're less healthy without eating it, I don't know. But I think, a lot of people do just well on steak. And I eat organ meat very rarely. Occasionally I eat chicken heart, chicken liver, but marrow, I add marrow sometimes. So I think you can be healthy. I think removing the bad stuff is more important, and you're going to get a lot of it from the other thing. But I don't think... It's not bad. The fat in it is not, we already established that. I don't believe fat is the enemy. It's actually a lot of good stuff. There's essential fats we cannot get. There's vitamins we cannot get without eating animal protein. So otherwise, it's to supplement. And I think eggs are organ meat. You eat the whole chicken in an egg form. So I think eggs is a good substitute for organ meat, because you get a lot of the good stuff. That's how I think about egg yolk, at least sometimes.
Interesting. Yeah. I like that. Just out of curiosity, have you ever had people who are like get nauseous when they eat eggs? I do that.
Yes.
Not bad, but there's just something, and it's not that I dislike them. I just don't want them very often. And when I do, I have just a slight nausea.
My sister is like that. She loves to be able to eat more eggs, but if she eats more too much or too often, she gets nauseous or she gets sometimes bloated. I never understand why. I never investigated. I can eat eggs all day long and actually tease like, I don't know what's wrong with you, but it's just so I know some people do. I don't know what the sensitivity to the egg white. Is it the chicken feeds? She noticed when I get some eggs from pasture raised farmers market type chickens, just eating whatever, she has less reaction to it than store-bought eggs. So there's something there, whether it's egg sensitivity or whatever proportion of feed in it. But I think it does exist, which is unfortunate because that's my go-to.
Yeah. I don't dislike them, and I've eaten them my whole life. It's just I have started to recognize, I guess because I eat so clean, really, that when I notice things that are slightly not quite right. I mean, it's not major, and I still eat them, but it's like.
Have you tried like the egg yolk alone versus the egg white alone?
I actually haven't. I don't really think I have in any way. Really.
It would be interesting to see which part is. Hopefully, only the egg white, because a lot of nutrition is in the egg yolk. So
I do.
Maybe you can tolerate.
I like the egg yolk.
Yeah, that's right.
I don't like
you can
the
tolerate
white.
more egg, so you can remove a lot of the egg white and eat less egg white.
I may try that. That might be a good experiment. I'll have to try that. Okay. Oh, I saw something that you posted that I just want a little clarification on. You said that we're actually dealing with two different pandemics. I like that post. Can you elaborate just a little?
About
it doesn't have
COVID
to be in depth. Yeah.
Yeah. Well, I mean, as a hospitalist, I had also the privilege to take care of COVID patients. And then I was on the forefront, I was the hospitalist taking care. No other doctor would see them only the hospitalists, because they want to minimize exposure.
Oh, okay.
And the common theme is obesity and diabetes in people who end up in the hospital. I know a lot of people who got COVID and don't have that, so they don't end up in the hospital, but you can't control if you're old or you have some cancer or some other things, but a lot of the young people who ended up in the hospital on oxygen, in the ICU, intubated or dying, healthy, no other medical problems, unless you look at it from a visceral fat perspective. And then you see a common thing, and that's a real problem. I think COVID would have been a no issue for us if we were metabolically healthy, and that's the sad part. And I took some heat for that. People think I was shaming people and telling them they're fat and stuff like that. But I was just pointing out that it's a fact that if you have insulin resistance, diabetes, obesity, you are much more likely to have complications, end up in a hospital and dying. And that's the real epidemic, pandemic, whatever you call. And that's under our control. You can't control the virus. It's doing what it wants to do. You can try to hide, or you can get, or you can eat better.
See, I 100% agree with that. And as we've been discussing through this whole podcast, is that those conditions can be improved. And if you improved those conditions, you wouldn't have to worry so much about every illness out there, every virus, every bacteria, every whatever. And I'm not saying it's not going to hit you hard or anything like that, but it gives your immune system the best chance of doing what it's supposed to do. We have it for a reason.
Yeah, I do think COVID, I've seen the worst of the worst complications, and some people who their only problem really is their 30s and they're just a little bit overweight. Sometimes it's not like they're sick and they were destined to do that. You would be shocked. Some people are obese and they walk out of the hospital just fine. And you can never guess who's going to get hit hard, but it's an increased risk. And to comment what you said, unfortunately, there's a report came out that most people gain on average on 20 pounds this past year. So if we were able to gain 20 pounds, we could have all lost 20 pounds on average. And if we have done that in reverse, that would imagine how healthier we would be as a society. But I mean, I don't want to get political, but it's sad that we're keeping people more indoors and no sun exposure, no activities, eating junk food, and I think it made things worse.
Oh, absolutely. And the fact that you don't have as much contact with humans, you need that to thrive. And
Yeah.
I never fully understood just how much I need it than this past year and a half. Luckily, we weren't as, bad off as other places.
Yeah,
so
right.
I still even had socialization, but compared to what I would normally do or whatever, and that's harmful for people, especially little kids, So
of course.
you don't have that human contact. So
yeah,
important.
Even when you're hanging out together, you're still not hugging and touching and being playful. That still has a effect. I recently started doing jiu-jitsu just for exposure to new sport. And as loving, I mean, I loved actually the contact and the sweat and so people would think I'm weird, but that kind of physical touch, and I don't know, it does something to the mind, because you walk out of there feels almost like high on the energy, and you feel more human. Yeah, you got dirt and you got injured or got sweaty, you just take a shower,
But that's good. That's all good for you. That's good for your immune system to get a little dirty, to get down and,
Exactly.
Yeah. I treat my granddaughter a little bit differently than I did my kids. My kids, for me, they were spotless. Never were they dirty, ever. I mean, they had a little runny nose. I'm cleaning it, and I change their clothes 3 and 4 times a day. My grandbaby, different story. She can go play in the sand. She can play in the dirt. I'm like, work on that immune system, baby. Go for it.
You can always return her. You can always return her to her mother.
Here she's dirty now.
Good problem.
But, she's probably going to be healthier for that. So there's definitely something to, seeding your immune system.
Right, exactly. I believe it.
Okay, so let's pull everything together. I want you to give everybody your best tips of improving your health and your immune system, really.
Sure. Well, one, it's a decision. You have to recognize that you are unhealthy and you want to make a decision and make a change. And once you make that mental change, the rest becomes easy. To become healthy, physically, and emotion, all that stuff, it really goes back to food is medicine. And then it's about more removing the stuff that's toxic. So junk food, you don't have to become carnivore, keto, anything like that. Just stop junk food, replace your pantry food with more healthy food, and don't be afraid of meat, and eat your vegetables, whatever you want. You can eat your fruit, whatever you want. I'm not making you zero carb, but I think just if you eliminate sugar as much as possible, refined flours, and any processed industrial oils for your cooking, I think that alone will make you so much healthier than the rest of the population. Add eating more and get full and satiated, then it's effortless after that. It's hard, it's simple, it's not easy. You just have to do the work initially, and becomes second nature. If you're not motivated enough, look at your families. Like if you have grandfather, father, mother, or grandmother with diabetes and complications, that's you. You can't change your genetics, but you can change whether they turn on or not, for that.
And I know you have other tips. So we hit the food. What other things, like when you're looking at it holistically?
Yes.
What are some, because food is a big piece, but what about all the other little pieces?
The mind and the emotion. So you gotta nourish your mind. You want to stop like feeding your mind like crap. Basically all this junk news, the social media, which is a double-edged sword. You can learn a lot, but it can also become completely become anxious from it. So clean. Also go on a diet mentally. learn something new. I mean, I pick up a book, like learn a new skill. I like philosophy. Sometimes I read some stoicism. It kind of helps me deal with the different issues in life. Outside, the sun is, well, I tweeted something, the best doctors right now is food, sun, sleep, exercise and laughter. So, just spend time with others, less on your phone, eat better, walk out in the sun, exercise, all these things, mental health, and face your demons, face your emotions. You got to process this stuff, physical, mental, and emotional. So if you need a counselor, go to a counselor. Just deal with these issues. If you're physically healthy but mentally and emotionally not there, what's the point?
Yes. And that's why I wanted you to come on, because I love how you kind of work on everything. It's awesome, because I'm understanding this more and more. I was more focused so much on diet that I knew this stuff was important, but I didn't really focus on it. And now I'm like, okay, this is a big piece, but there's all this other stuff too. So
There's a reason
that.
you were so physically sick. I was in the same boat. When you're so physically sick and in pain and whatever, that's you focus on that. Once you lifted that, you became healthier. All of a sudden, you can be aware of all these things, and you become more interested in the personal growth and mental growth and stuff.
Absolutely.
Like that. And that's why you're evolving. If you're the same person you were last year, you're not. Something isn't right,
Yes, I love that. Perfect. Well, Elie, it has been a pleasure, and I appreciate you coming on. And hey, y'all, subscribe to my channel, and go follow Elie. I'll have all his information below. And
awesome.
again, it was a pleasure.
And
you have a wonderful day.
Awesome. Yeah. You too.
Bye, Elie.
Bye.